you've been a big advocate for increasing flexibility in healthcare options for all Americans. How would legislation like your Personalized Care Act that you introduced give individuals more healthcare freedom by expanding health savings accounts?
Well, I'm glad you asked that question. Just the other day, I had a friend who was asking around trying to figure out what to do to get healthcare because they lost their job and they were stuck because of the current economic situation. This is part of the problem, right? Is that we've allowed our system to be built around this kind of false connection to your job. Not that your employer can't provide you healthcare. That's all fine and dandy in a free country. But what we don't want to do is have you be reliant upon that. So this friend was then told, we gave her some of the options that, you can go to this direct primary care doctor and you can get care for $59 a month and they'll cover this, and this. And you just go in, you don't have a waiting list. You can sign up for whatever you want. And they said, wait a minute, that exists? Yes, that exists. The problem is we've allowed insurance companies to take charge of and run our healthcare system. And that is just as bad as an overall government-run healthcare system. We don't want that. We want freedom, choice, options. We want you to be able to go to the doctor of your choice. Doesn't mean that there isn't a role, particularly for veterans and for those in our military service, to have hospitals and care that is directly funded and supported by the government. But what it means is we want to provide massive numbers of options for our veterans and for all those in our community to be able to go out and access care. So the Personalized Care Act, the Healthcare Freedom Act, these are two bills that are very similar. I've introduced both in the House. Those bills would increase the amount of money and that you can have in your health savings accounts, and importantly, increase the ways you can use them. Allow you to use that money for direct primary care doctors. Allow that to use that money for example, health sharing ministries where you can share the costs with people. Allow it to use it for catastrophic insurance coverage. Allow it to give you the flexibility to use that money for your health so that you control your health care. Because right now, the problem is an insurance bureaucrat, usually some 25-year-old on the other end of a phone line in Omaha, Nebraska, is picking up the phone and saying, well, this doctor's out of network, or this isn't going to be covered, or this is going to be a deductible of $20,000. You're going, wait, hold on a second. I just want to go get health care. And we've got to return to that, right? And think about the black bag doctor, right? And get to that place. And so personalized care is where we think we ought to go. I think that's going to shine coming out of what we're dealing with coronavirus, where we need more of those options, not fewer. And so I've been happy to promote that. And we're also promoting that within the VA as well, where we've got legislation where we're trying to promote VA DPC, where you've got the ability to get direct primary care services while still under the umbrella of the VA, and make sure that you're covered and you've got the care that you want. Because there's no reason you shouldn't be able to go, especially if you're in a small town and you don't have a VA facility there, go to your local doctor and pay a set fee and be able to get the care you need.